Hi friends, today we are going to start a new topic in neurological disorders, which is babinski reflex part 2. In part 1 we have learned how the babinski reflex works and how they get to know that the patient is not central nervous system is normal and all. And fibromyalgia also we have covered in previous class. If you have not watched it, let's summarize in this class also. Especially fibromyalgia is an pain gets when your posture of the body is not proper, or of the sensational traumas or infections, or by the bones weakness of the bones, we can suffer fibromyalgia. Fibromyalgia can happen in our head, brain side, and neck side. You can see neck also, and on the stomach, and in our hands and the leg. This lap also, on the lap also. So this it happens in this all parts on, and it happens also on back, because back support is very important for your body. So we should use back support for avoiding this all fibromyalgia. I hope you understand fibromyalgia. Let's start with our main topic, which is babinski reflex part 2. Especially babinski reflex is an reflex which we use to solve when we are suffering from a main thing, suffering from the central nervous system problems like the paralyzation, and some body parts like fingers are not working. If your fingers can't move properly, we should we should use we should check by the babinski reflex. We can't check by our own, that we have to get more knowledge about it. You can check, means toply we can check with that. If your thumb is this, you have to take, you have the positive, and your central nervous system is abnormal. You have to do something for it. Not like that. You have to go for in a orthopathic, which fixes our central nervous system, or neurological neurosurgeon, which can give neurosurgeon healthcare provider, which can give our which can give more examples and cure about it. So it is better to go to the healthcare neurosurgeon provider, who can give us this all information. Now let's talk about the Babinski reflex. How it happens? Babinski reflex happens when your posture, same symptoms like the fibromyalgia. When your posture, when your physical traumas, sensational traumas, physical posture, or your for your weakness, arm weakness, bone weakness, or nerve weakness. If your fiber is not enough in your body, then it can be happen. For mainly it happens because of fiber. Because when your fiber is not there, your when nerves get killed by the uh, multiple sclerosis. When the multiple sclerosis kills the neurons and nerves, then your hands will get fibromyalgia, and then you get fibromyalgia. You can't define what is going on your central nervous system. So for that we use babinski reflex. Babinski reflex help us to find the status of our central nervous system, and it is good for find doing the babinski reflex help from the neurosurgeon healthcare provider. So especially the neurosurgeon healthcare providers can give, first they will take the negative or positive. If the case is positive, they will do some analyzation on it. Means the positive patient will have some x-rays of the whole body, and then the x-rays, if the x-rays looks zigzag, or the some bones are getting swelled, or getting bones are getting grown from one side or another side, so the patient should has to be taken the Babinski reflex. And if the patient has severe pain in all over the body, then the central nervous system has is in abnormal, biggest abnormal danger, severe Babin's danger, severe central nervous system has been your uh, central nervous system is not working. And this is uses for the adults, and old women, men's, child's, babies, young children's, teenagers, all can check this Babinski reflex. By the Babinski reflex, all central nervous systems can be verified. So I hope you understand what is the Babinski reflex. Now, the fibromyalgia works in our body when the body doesn't have the posture. When the body is not in proper posture, we will get fibromyalgia. Fibromyalgia happens when the body is not in our proper posture, or in our back is paining, and our nerves are getting heated by the neurons and nerves are getting heated by the multiple sclerosis, which are the germs which get formed by the which get formed in our bloods when the blood circulation doesn't touch the nerves, because the nerves, if the nerves get eaten by the multiple sclerosis, the blood doesn't flow properly, and that cause of that our we can get so many problems, like we can sleep properly, or we can't work properly, we can't walk properly, we will get confused, and our face will look drowsiness, and we will suffer fatigue in fibromyalgia also, and multiple sclerosis. So these three of them has same system symptoms, and some of them are cured, and some of them are some of them make us too easier to explain, understand. So Babinski reflex is used for fibromyalgia and multiple sclerosis. So this was my video. I hope you understand. If you understand, give a thumbs up, like.